Now it's time for our Shifting the Narrative panel. Tales spun of Africa are so often authored outside the continent, leading to an inauthentic portrayal that can sometimes be quite pervasive. So much so that Africans have been led to believe some of this misrepresentation themselves. In this next conversation, we will stare into the face of these inaccurate narratives and offer something more true and more compelling as an alternative. What if African visionaries took up their pens, their instruments, and their voices to offer their own narrative? That's what we're about to look at now.
Welcome, everyone. I want to offer thanks and congrats to the team at Segal Family Foundation and that of BMW Foundation. So far, so good, gang. I also want to welcome once again to those in the audience. Appreciate you sticking with us this far. Special thanks to Anand and Sherwan. They did their part. At times, I found myself rolling my eyes in annoyance, shaking my head defensively, nodding along in admiration or admonition. It was provoking, to say the least. My name is Andy Bryant. I'm the Executive Director of Segal Family Foundation. I have the great privilege to shepherd this next conversation. It's one of hope and self-determination under this guise of shifting the narrative. We work in an industry, a sector rife with misconceptions and oftentimes misinformation about how change happens, who authors it, who gets credit for it, how long it lasts. As false narratives are constructed, often upon foundations of cynicism and self-interest and racism, we must respond by constructing new narratives. But let's build ours on the pillars of hope and self-determination. When President Bill Clinton spoke at this meeting in 2013, he gave us a quote that I think remains true and relevant today. Quote, "The world belongs to the creative cooperators. The headlines about Africa are dominated by stories of constant conflict. But beneath the headlines, the trend lines are going our way. You must not be discouraged by the fact that doing good is often not considered good news. It is the ultimate good news." End quote. The Future Summit is a convening of hope. We're here taking part because despite the calamities of 2020 and 2021, despite the decades of hardship that we've endured before, we are bowed but not broken. Segal Family Foundation's own work is founded upon hope. We spent more than a decade literally buying into a hopeful development narrative and agenda. Other Western funders have beaten us over the head quite often with the same themes over and over again. African-led orgs are too hard to find, too difficult to trust, too challenging to measure, too small to be impactful. We responded with the proper amount of respect that we thought this cynicism deserved, which was to say bullshit, plain and simple. We've chosen hope, and we chose to invest in local organizations, visionaries, and vision. And we've been validated time and again by the evidence that such orgs and such efforts are not only often more just, but also more impactful and more sustainable, and yet so often get short shrift. Segal Family Foundation plans to do something about this. We recently authored our Vision 2030. It states, by the end of 2030, Segal Family Foundation will be the largest and most influential network of interconnected hubs and change makers across sub-Saharan Africa, placing local visionaries at the center of national and regional development agendas. Quite simply, those who've been taught in classrooms and treated in clinics are best placed to transform those spaces for the better. The good news, as Anand alluded to, in the past few years, everyone seems to have been aligned in their belief that local organizations can and should be driving development agendas. The challenge now is to make it happen. We invite our fellow funders, great and small, African and Western, to join us in figuring out the how. Spoiler alert, it's not terribly difficult. You find passionate and talented people from the communities you seek to serve, you cede to them power and purse strings, and you get out of their way. It'll be my pleasure now to introduce my two panelists. Degan Ali is the executive director of Adeso, which is an African development and humanitarian organization that's changing the way people think about and deliver aid in Africa by empowering communities to be agents of change and using new and innovative aid delivery methods. Among other things, in 2003, Degan designed and oversaw the first large-scale cash transfer distribution program in Africa, implemented by an NGO rather than a government agency. Under her leadership, Adeso pioneered and championed market-based and dignified solutions to aid, globally allowing cash transfers to become a standard type of aid response. Most recently, Degan has been acting as a leading advocate for the empowerment of Southern NGOs, calling for a global network of NGOs run by the South for the South, where the voices of local, national, and regional Southern actors can be heard. That's the formal bio. For me, Degan is a warrior in Jordans and a hijab. Her Cheshire cat grin belies her true nature as a rabble-rouser, shit-stirrer, troublemaker, bar none. She says what she means and she means what she says, and that, unfortunately, is all too rare in this sector. There's no one who champions the concept of self-determination more than Degan Ali. Dr. Raj Panjabi was appointed by President Joe Biden to head the United States President's Malaria Initiative in February of this year. Born in Liberia, Dr. Panjabi settled in the United States after fleeing civil war as a child. Before joining PMI, he served as the CEO of Last Mile Health, an award-winning nonprofit he founded in 2007. At Last Mile Health, he enabled community and frontline health workers to deliver life-saving care, including for malaria, COVID-19, Ebola, and other diseases, to the world's most remote places. He's recognized as a thought leader and social entrepreneur passionate about building rural health systems and ending epidemics. Time magazine named him one of the 100 most influential people in the world and 50 most influential people in healthcare. He's also been listed as one of the world's 50 greatest leaders by Fortune and a recipient of the $1 million TED Prize. But for me, Raj is a healer, a friend, a father, a shoulder to cry on occasion. He stared into the devil that was Ebola, and I know he felt fear and uncertainty. He felt fear for himself, for those he loved, for his team. But then rather than run away from that scourge, he put on a mask, put on gloves, he armed himself with the best protection that medicine and science could offer, and he went forward. And speaking of hope, the WHO announced just yesterday the world's first malaria vaccine. My sincere hope is that Raj is out of work within a few years and on to the next health crisis that will be solved by science, courage, and love. Thank you both for joining me. It's a pleasure to be with you. Let's get started. Degan, I'll start with you around this theme of hope. What gives you hope after these many years of struggle and striving to build Adeso and serve its communities? What are the little things that inspire you daily? What are the big themes that serve as your compass? Thank you.
Thank you, Andy, and thank you for having me. I think the thing that gives me hope, frankly, is seeing the evolution of where we are. 20 years ago, when I would talk about these issues, it would be constantly received with defensiveness, anger. Sometimes, you know, as recent as 2019, even being blacklisted by donors. When I talk about racism in the sector, the colonialism in the sector, and all of these issues. So the fact that in such a short time, we've made a massive pivot and we can have these conversations, honest conversations, and where global North and white people are willing to truly reflect and have this reckoning, I think that's what gives me hope. And I think what also gives me hope is knowing that I have the privilege. I come from a privileged background. I have access to spaces that many of people in my communities don't. And I feel a sense of responsibility. And I feel like I have no other choice but to continue this fight and this battle and this movement, because what is the alternative? We can't give up. We have no other option. We have to be hopeful. Hope is the engine that keeps us moving and going. So we need to be hopeful. And what gives me hope is allies like you and others in the space that are going down this journey with us.
Thanks, Degan. Raj, what about you? Tell us why we should feel hopeful when so much of what we hear about, read about, and indeed experience in our day-to-day lives is cause for despair. No small questions here.
Well, no small questions ever expected from you, Andy. I'm glad we're starting with this because, what gives me hope is that fundamental idea that we as people, we're not defined by the conditions we face. We're defined by how we respond to them. And I've seen that play out in my own life. You mentioned I grew up in Liberia and fled during the Civil War. Well, my family arrived here in the U.S. in 1990. I was 9 years old, and we were trying to rebuild our lives. My father took a loan out and ended up starting a clothing shop in Winston-Salem, North Carolina. And when business was going bad, he would say this phrase, "No condition is permanent." And that phrase has stuck with me. I frankly found it annoying as a teenager. It's one of those things your parents tell you as a pearl of wisdom, and you later realize at the holiday dinner many years later that it's actually shaped your life. And I think that that idea actually came from West Africa. He read it in a novel from a Nigerian novel, and it's been an anchor for me. But I've seen that idea manifest in the work I'm doing now. I've worked with on global health for a long time, and in this new role that since February, leading the U.S. President's Malaria Initiative, we're trying to fight the oldest pandemic. It's the deadliest pandemic of children perhaps ever. And when I fell sick with malaria as a child, as many people I'm sure on the line have, when I fell sick in 1981, about 1 million children, Andy, were dying from malaria every year. But when I turned 20 in the early 2000s, the Global Fund and the U.S. President's Malaria Initiative, were formed, and with sustained global funding, national governments, local health workers, community health workers, nurses have been able to save over 7.5 million lives and prevent over 1.5 billion cases of malaria. And that simply means, Andy, that a lot more children have access to the tests and medicines they need and have a net cast over their bed at night to protect themselves from mosquitoes, just like I had when I was a child. So I think the lesson I take from that, and what else gives me hope, is all of you. When you look at Segal Family Foundation's conference in 2013, 8 years ago, there were maybe 300 people there. Today there's 3,000 people and more watching this summit. And I think that each of you who are working to have a strategic advantage that is rare and is unique, and that is that you are of the places where you are working on these problems. And that long-term engagement isn't simply that commitment to people in place is the difference. It makes the difference in turning ideas of charity and goodwill into expressions of justice and equity. And I'm not just saying those words. These are not theories. This is borne out by the evidence. And that's the last thing that gives me hope, Andy. When you look, there was an article about long-term engagement when it comes to creating social movements. And I think it was in the Harvard Business Review a few years ago. And I think the title of it was called Audacious Philanthropy. But the article was about the 15 social movements, from polio eradication to ensuring, seatbelts are in cars for you or my children. And they looked back and said, well, we take these things for granted today, but how did these things come about? What were the predictors of success? And they had a few things in there. You've heard a few of those themes already. Public policy had to change. There had to be consistent philanthropy over many years. There often had to be reform of collaborations between the public sector, the private sector, and nonprofits. But the number one factor was long-term engagement. And Andy, if I were to ask you, I know you're doing the questioning, not me, but allow me for a second. How long do you think it took for those movements to actually have the impact they needed? 5 years, 10 years?
Generations?
Yeah, it turned out that 90% of those movements took 45 years of sustained efforts. 90% took 45 years. And that can be a little depressing because, one thinks, well, how long does it take to create change? Why can't we speed that up? I think we can, but the median was 20 years of that. So again, so what I mean is that you have that strategic advantage. No one else does, because this is more important than it being just work. This is about a commitment to people and place. And I have to say, having been part of the Segal community for many years, first as a social entrepreneur, that commitment to people and place is not a soft commitment. It's not a wishy-washy, hunky-dory commitment. It is, yes, a spiritual one, yes, a personal one, but it's actually a strategic advantage because of the science that's showing that's critical to making long-term change. That gives me hope, Andy.
Thanks, Raj. I want to shift to this self-determination theme. I'll ask both of you in turn, but both of you were born in sub-Saharan Africa, but moved to the US in your childhood. I'm sure you've struggled to define what it means to be an authentic representative voice for the people you've sought to serve. How do you see your role in advocating for African communities to be in charge of their own development? Again, no small questions. Degan, would you mind fielding that one?
I see my role as a facilitator. I see my role as an activist. I see my role as I said, I have the privilege of having access to quality education, understanding the language and the lingo of the West, simultaneously, while also being from my people and understanding their issues intimately. So I'm always between two different worlds. And I think that that's a huge level of responsibility, I feel, towards ensuring that when I'm in these spaces, that I remember the people who are not able to have a passport and travel easily to these conferences or these events in the global north, things that we take for granted. Many of us take for granted the ability to just travel and get on an airplane and go to a conference in Geneva or New York without very little difficulties, at most maybe a 24-hour visa that you have to do, or 48-hour visa, where if you're a Somali or a Liberian or, it's quite difficult and complex, and oftentimes you don't get that visa. So just the access and the movement in itself, plus all the language barriers and all of these issues. And I think that's what allowed me to be able to articulate the issues because I would go into these spaces and I would sit with brown and Black people from the global South, and we all had the same problems. And it was a aha moment for me when I realized that what I was experiencing in Somalia was being experienced in Asia, West Africa, in Southern Africa, in the Middle East, and that wasn't unique. But because we're always meeting each other in the global north through intermediaries, through proxies, we don't get an opportunity to actually meet and create a coalition and a movement across the global south. And, the global north INGOs and UN agencies act as excellent gatekeepers from developing that movement. And when I would go to these spaces, I realized, wait a minute, why do we have to have an invitation to a conference in Geneva for us to talk, to relate, to understand our issues are very common, and to form a strategy on how to address these problems? And then, that's how the idea of the NEAR network came about, because I was like, why are we always begging them to let us in? They would complain and say this network in Geneva or that network in the US or this network in another place was not addressing our issues effectively. And I said, these are their spaces. This is their networks. Why are we always trying to knock on the door politely and ask to be let in? Why don't we develop our own networks, our own coalitions, our own movements across the global South? And we then demand the change that we need to happen in this space. And that's how the NEAR network came about. So I feel like it's a huge responsibility, having this privilege, having this access, having the passport, having the language. And I think that it's unfortunate for me is when I see that a lot of my sisters and brothers in the global South, unfortunately, have the same problems, see the same issues, articulate it to me privately, but don't feel the level of confidence, or are scared of being blacklisted, and don't feel the level of freedom to be able to say the things that need to be said. So I'm always being pushed in this position of saying, Degan, please speak for us. Degan, do this for us. And I don't want that. I want other leaders to rise up to be able to do what I do. It's not unique. I'm not extraordinary in any way. I'm just a normal person that has just the opportunity to have had understanding of both worlds. So I feel a sense of responsibility to ensure that not only I represent the woman who has to walk, a mile to get water or firewood in Somalia, but that I also help other leaders in the global South come up into these spaces and represent these issues effectively and support their confidence building, provide them mentorship, provide them an opportunity to access. So that's also a sense of responsibility I have, not only to the communities that I try to serve, but also to my other global South allies and friends in this space.
Brilliant. Well said. And thank you. Let me take a moment too to acknowledge. I sent you both an email yesterday saying, I recognize you sit in sensitive places and have lots of competing forces on your person, on your words, on your deeds. But I asked you to go there and be outspoken and be true to speaking truth to power. And there's real life consequences, as you said, from your form of blacklisting to the hesitancy you see amongst your would-be fellow activists to speak up and speak out. And so I appreciate the vulnerability and speaking truth to power. Raj, let me ask you the same question. How you see your role in advocating for African communities to be in charge of their own development?
I really want to thank Degan for sharing what she did. And I guess the first thing I'll say is, I think she's right. When you're an immigrant and it takes you, as it took my family, 11 years to get a green card, and during that time you can't travel anywhere, and you have the ruptures in your family and you can't see them. Your parents can't see their parents, your parents can't see their brothers and sisters, you can't go back to the country that you were born in. There is a certain responsibility one has to share those experiences, to use them to generate some empathy for those who are seeking dignity and equity. And at work, I'll say this, I'm acutely aware that I've spent as a social entrepreneur, someone, who worked with local community health workers in Liberia, had to raise $6,000 from my wedding to start it because no one would give us a grant at that time. And until, again, we met the Segal Family Foundation many years ago, who wanted to invest locally. That's a true story. It's not even made up. It's 6 years later, Segal says, here's a commitment because we're focused on investing in local partners. I was asking for a seat at the table. And now I'm acutely aware that I'm the first person born in Africa to be leading an initiative to eradicate a disease that kills more people in Africa and has killed more people in Africa and will kill more people in Africa if we don't do something more about it than anywhere else. And so now I'm not asking for a seat at the table. I have a chance to set the table. And I've been trying in my role, though I think not always succeeding, but trying to do that. And let me just give you one example of this. And the day I was appointed, there was I had shared on Twitter how grateful I was for this opportunity to be a son of Africa and to then be adopted by America and have this chance to serve. And literally within hours, there was a Twitter storm happening by colleagues in the malaria space, Dr. Ngozi Irondu, and several local researchers who are from parts of Africa and have researched on malaria for a very long time. We're arguing that a recent grant that had been made by PMI for about $30 million had gone to 7 Western institutions, and none of the local research institutions who were featured in that financing in a serious way. And a few months later, they wrote an article in Nature Medicine, which is one of the leading journals, and it called out the President's Malaria Initiative as an example of this example as one that signaled why we need to decolonize aid and how far we are from that. And one of the things that came up for me as a leader in this role, having lived some of the experiences those my colleagues were sharing, and knowing the pain that was being shared, and also the dignity that was being communicated, because in that letter they said we would be happy to work with people to create more dignified and equal partnerships. My team and I went back to PMI is housed at USAID, so it was with colleagues there, and said, what if we don't do the typical statement about what we have done? What if we actually acknowledge that whatever we have done, we haven't done enough? And what if we actually shared the article that was critiquing us on our own website, pmi.gov, and pointed to and said that we agree with the principle of dignified equal partnership? And what if we actually wrote to the authors of the letter and said, we hear you, we'd like to talk? And that was the subject line of my email to Ngozi, the lead author of that paper. And my team, about 15 of us, met with all 7 of the researchers a couple weeks later. We were grateful they gave us their time to share with us, and they came with 7 key messages. And one of their messages was that those who have the lived experience of these diseases from the endemic countries ought to be leading the conversation. They said, if you've been building capacity for over 50 years and the capacity is still not built, what are you doing wrong? And I was so thankful to my colleagues in global health at USAID who are working on diversity, equity, and inclusion to then invite a couple of them back to the whole bureau and to share those concerns. And so I share that example. Now we are, we just launched a new strategy yesterday for PMI. Our goal is to help contribute to the global goals of saving 4 million additional lives and preventing an additional billion infections. And one of the ways we're going to get there, one of the top 5 strategic focuses, is to invest locally. And we have quoted Ngozi and her colleagues as the way we want to lead. And I wrote them a note yesterday saying, words are nice, but action is better. And so we are working with them to try to set up a group of local partners, their idea, to help us make good on that commitment. And I hope they and others will hold institutions like ours and accountable, because that is critical. So I think that's the responsibility we have when we have been speaking truth to power, and then you're in power, is to allow others to speak truth.
I love it. I think one of the chief tools wielded by those in power is a massive broom to sweep all the critiques and uncomfortable truths underneath a rug. So it seems like you broke that broom in two, Raj, and decided to air your critiques out front. I think that's really, really wonderful. If I can indulge you both, I was curious, in my own self-interest, what's my role? I'm as you might have seen, a white male privileged guy in philanthropy. Like so many others, I hold a lot of power and most likely good intentions, but don't always know the right path. And so this is the question I ask myself in front of the mirror every morning, which is, how do I and others like me hold legitimate places in sub-Saharan African development? This for me is the not small question of the day, of the year, of my life's work. Degan, what do you think? How do I act legitimately in this role and others like me?
I think to be a serious ally in this movement, you need to, one, be humble and do what Raj was doing, which is to really listen. And oftentimes that doesn't happen. We're always in the global South facing global North actors, and I say that in general, whether it's an INGO, UN, or philanthropist, who oftentimes think that they know what is good for us, or they have an idea or they have a solution without really listening. And so there's huge amounts of humility that needs to be practiced in how we work. And that doesn't happen. I think it's also just, humility, lots of arrogance. I'm sorry to say, huge amounts of hubris. And the second thing I would say is that we do need white allies like you. I don't have the power to influence US philanthropy sitting in Kenya. I don't have the power to influence USAID or FCDO, but you sitting in those capitals from those countries, as civil society, as philanthropy, have that ability to do that work. And you need to realize that that's your priority. Your priority is to change the system. Your priority is not to say global South actors or leaders are the ones who are going to change it. No, you have an equal, if not more, responsibility, because the power and the resources lie in your backyard with people from your nation, your fellow citizens. So there is a huge amount, the same amount of responsibility that I feel towards my communities and to my global South sisters and brothers is the same kind of responsibility that you in the global North capitals need to feel towards the terrible behavior of your donor governments and your INGOs in your countries. You need to feel that sense of responsibility and shame for this conduct that happens every day in our communities. And so that's the second thing. I mean, your ability and your your priority number one should be about influencing your peers in the philanthropy space and in the bilateral space. Number three, I would say, is put your money where your mouth is. Yeah, Segal does that in many ways, but that's unusual, Andy. Segal is not the norm. I was just looking at a pie chart of how much the largest foundation in the US, I think, is Gates. About 80-something% of their funding goes to global North actors, and they're not unique. Majority of them are like that. So, we need you to support the movements. We need you to support the infrastructure, the logistics that this movement needs. We need you to, help pilot new ideas, new initiatives that global South actors have. We don't lack innovation and creativity. What we lack is resources. We don't lack ideas. I always say, necessity is the mother of all inventions. We MacGyver things constantly in the global South because we are in a constant position of deficit and not deficit in terms of ideas and capacity, but in deficit in terms of resources. We are not deficient in terms of being able to tackle our own problems. The problem is that where is the money channel to? But back to what Anand has been talking about, and we need to accept that and realize that. And most importantly, and last recommendation I would say is we need to do proper movement building to reconstruct the entire aid system. We don't need aid in Africa. What we need is a level playing field. We need the rules of the game to be fair, and they're not fair currently. Whether that's in the WTO rules on trade, whether it's the IMF and the World Bank, whatever it may be, those are the kinds of real systemic issues. And we need support of global North civil society, and we need support of philanthropy to fund this movement to change that system and to recognize and call it what it is. Millions and millions and millions of people in China were not lifted out of poverty because of a UNDP program or because of a Ford Foundation projects. They were lifted out of poverty because of government policy and strategies for industrialization. Those opportunities are not given to us in Africa. We are still seen as a source of raw materials and an opportunity to extract raw materials from us, rather than be a producer of products and goods that are exported to the global North. That is what's going to lift us out of poverty, not these aid programs. And to make that happen, we need to understand that this aid architecture is just a way to camouflage the real issues, and we are not tackling the root causes of poverty. And this is all a distraction, in my opinion. And we're part of that. We're complicit in that. And we need the philanthropy space, because the bilaterals, I don't think, are going to fund those kind of movement building work that needs to be done. But we need the philanthropists to fund that movement building.
Well said. And I feel a tremendous burden of responsibility to grow bigger ears, firstly, and do the listening that's required to set about doing something right and righteous. Raj, I wanted to shift a little bit. Certainly feel free to add to that sort of like notion of allyship that Degan so beautifully laid out. But I wanted to talk about localization agenda in the context of USAID's work. I think you've already, in your short time there, demonstrated some really cool successes in substantively, legitimately moving the needle, which in a big, challenging bureaucracy. But I wanted to understand a little bit about your aspirations for change towards and that localization agenda within USAID.
Well, I think a lot of my colleagues at USAID share this view that one of the biggest levers we have to change and transform global health and achieve global health equity, including in sub-Saharan Africa, is the basic idea of proximity, right? It's not local capacity, it's not even localization or locally led development. It's the idea that investing in the people closest to those we seek to serve has always been the greatest development tool that we've used. And that could be the partners that are from those countries. It could be the local community health workers that are from those rural communities. And so we've seen the power of that proximity at work. We've seen the power of investing in local implementing partners, right? The organizations closest to those we serve. In Southern Africa, for example, the capacity strengthened by USAID's HIV programs with partners like Right to Care and the Loop Commission has been leveraged to respond directly to the COVID crisis. And now these partners, local partners, are playing a leading role in the rollout of COVID vaccines, trying to improve oxygen supply. And we've seen the power, Andy, of investing in local research institutions. We haven't done enough, but we've seen the power of what we have when we have done it. The scientists closest to those we serve. In Rwanda, it is kind of striking to me. We've been working with the Rwanda Biomedical Center for years, trying to help detect signs of resistance to drugs to treat malaria. And the scientists there, Rwandan scientists, published a lead author paper in The Lancet, a leading medical journal, in August that showed the first signs of partial resistance to the artemisinin drug, the drug that is the mainstay of malaria therapy in Africa. Well, those same scientists have also been on the front lines of helping detect COVID variants. And we've seen the power of investing in local governments, right? The leaders closest to those we serve. I saw it in Liberia. I mean, USAID's decade-long investment in a government-to-government partnership actually prepared the government to respond better to the 2013-16 Ebola outbreak, helped improve access to essential health services afterwards, in part because it contributed to improving public financial management, right? And we've also partnered with groups like Aspen Management Partnership for Health, which is actually collaborating with ministries of health to strengthen their leadership and management capabilities. So we've seen that, and I would say, I give the credit to my boss, Administrator Samantha Power. She, in working with us on this new strategy for PMI, pointed out that even investing in local health workers, community health workers, the providers closest to those we serve, like many of you do, is actually a form of self-determination, of bringing the dollars closest. I mean, how much closer could you be than putting the money not even in an NGO management structure, but directly into the pockets of the very health workers from those communities? And we've seen, again, the power of doing that. The hundreds of thousands of community health workers have across the world, in partnership with many of you, sustained testing treatment for malaria, for other maternal child health conditions. They're on the front lines of COVID, going door to door to find the sick and get them tested. They're the ones teaching them how to wear masks and are more successful in doing that and persuading people to get shots in arms because they're of and from those communities, are trusted. So I say all this to say that investing in proximity is not just the right thing to do. That's the narrative, and we need to keep that up. It also turns out it's a strategic and smart thing to do. And one of the things I think we can be doing more of is actually is trying to bridge narrative, right? We sometimes demonize those in privilege and power. We should criticize, but demonizing doesn't help bridge communities. Demonizing doesn't allow an Andy Bryant to work for years and years, as you have with Segal Family Foundation, to establish offices in East Africa, to actually build relationships with entrepreneurs like myself, who no one else was willing to talk to, or Degan, and to bring them to a forum like this. It doesn't allow us, my point is, to build relationships, empathy, paired with tension, right? Dr. King talked about creative tension, not destructive tension, tension that is honest about the gap in the society, but is also trying to create something out of that. So one of the things I think we need to do is to realize that we have some common values here. The American taxpayer dollar, the philanthropist dollar, will actually go further if more people compete for that dollar. And the idea of competition is just as much an American idea, a Liberian idea, an Indian idea. And that's why I think we got to work harder to get some of the officials that I work with, that other philanthropists, to get to know people like Degan and myself and the 3,000 other people on this call, because getting to know them is critical. I asked my team, and I'll end on this point, I said, how many of you know, because we're talking about investing locally, and I said, how many of us know an executive in an international NGO or a CEO? And almost everybody raised their hand. So how many of us know an executive or CEO of a local organization? And there were just very few hands that were raised. Why can't we encourage the Segal model, right, where you actually accompany someone? What you did, you joined the board for many years. You put in sweat equity. Well, we can do that too. And I think, part of that means ensuring the structures are in place. And I'm so proud, our administrator at USAID has been honest, right? Only about 5% of USAID money goes to local partners. She said that in a Senate briefing, and now she's working hard, as other administrators have, but to say, okay, what can we do to staff up at the missions? Because no one's actually saying they don't want to do this, but they may need more staff time so they can actually join a local advisory board, perhaps of a local organization. Or what do we need to do to actually get those government-to-government agreements to work? Because it does take more effort to get them started, and can we expand it? So we do need leadership to unblock the structures, but first and foremost, I think we need to reach out and build real relationships based on empathy and mutual values, not capacity. I've never talked about, my parents never talked about their capacity when they were up. They talked about competing to build a good home goods business so they could pay for their family. When I was a nonprofit leader, I didn't talk about I didn't go saying, please build my capacity. I said, I want to build as best an organization I can to save lives in the world's remote communities. Will you help me do that? And that then allows us to help achieve scale. The reason the INGOs beat the local NGOs is in part because they have tremendous scale. And we have to level that competitive playing field. And if we do that, as I said, it's not just the right thing to do. The American taxpayer dollar goes further when more people compete for it. Barry Segal and Martin Segal and Dolly Segal's funding goes further when there's more competitors for that money. And in the end, the winner is the people we're trying to serve, because then they get to choose what services they want and not be dependent on one or two local NGOs or one or two international ones.
Thanks, Raj. Okay, gang, somehow time's flown by. We have a few minutes left. Degan, I wanted you to put you on the spot with a question from the audience, and it's not an easy one. So it's typical of an NGO crowd, a two-part question. Does a self-determination perspective offload the responsibility of those in global power to change unjust systems that they created? What frameworks can we use to resource leaders to rise up to demand change without letting global powers off the hook, right? So is it simply sort of passing the buck using cool new jargon, or is there a way to support the uplifting of local rock stars while also keeping that burden of responsibility on those who previously had power? I don't know if I explained that better. Give it a shot.
I think this goes back to what I was saying earlier, where you have just as much responsibility to fix the system as I do. And it's about mutuality. I think Raj also talked about that. It's about what solidarity really means. And I have a responsibility to stop talking about capacity as if I'm deficient, to stop talking about, to stop complaining, to start thinking about how I become proper civil society, hold my government accountable, stop chasing the money, stop thinking about a business model that replicates the INGOs, where we become mini versions of those INGOs. This is what we've been brainwashed to think is the metrics of success. The Global South CEO wants to become an IRC, wants to become a Save the Children. They don't want to become an Adeso and very happy at being an Adeso. Many of them, some of them do, but majority don't, because we've been brainwashed to think that that is the just as our allies or our counterparts in the global north have been brainwashed, and they have shifted their entire business model to become corporatized, to be about money, to be about growth, to be about scale. We have the same problem as well. So I have a responsibility to really deprogram myself and to start thinking of myself as genuine civil society. That my responsibility is to be a facilitator or representative, an effective representative of the needs of the communities, and in holding my government accountable, holding the private sector accountable, and holding the global north actors accountable. But there's an equal level of responsibility that you have in the global north, where you need to do the hard work yourself and hold your donor or your own governments accountable, and your international NGOs who are functioning like corporate entities and no longer functioning as civil society. They are not civil society. They try to say they are, but they are not. They are really implementers. They're just a nonprofit version of contractors and the Beltway bandits that we talk about. There's really no difference between DAI and some of these American INGOs. And so they need to understand that they have a responsibility to change their business model, to decolonize their business model, and to become real civil society and demonstrate real solidarity. Oftentimes, though, that means that you have to be willing to risk your growth and your income, because real decolonization means you cede power and you cede resources. And seeding that means that you are no longer measuring your success in becoming a $1 billion American NGO, but being happy at becoming a $200 million NGO or a $100 million NGO. And that's really hard. There are too many incentives to stay in the status quo and to have success be determined by money. And that's, I think, the crux of the problem is really the heart of it is around money and power and decision making. But I think I don't see it as one or the other. I don't see it as something where my self-determination is at the expense of your allyship. I think it is a mutuality that we have to work together in true solidarity, in real dignified partnerships of mutual respect.
Well said. I've been told by our team that our request to make this an 8-hour or 8-day conversation has been denied, sadly. But of course, I hope we just spark some inspiration and provocation amongst this audience. I wanted to end with the gimmick I offered earlier, which was I'd like you each in real quick 60-second sound bites offer us a good news prediction for the next year. What are you hoping for that you think will come down the pike in the next 12 months? Raj, go ahead.
I would, I think a prediction is that we make the legacy of the worst pandemic to hit us in a century to be a new healthcare system that actually reaches all people and is brings the fruits of modern science to every corner of the earth. I think the way we do that a year from today, with the headlines, we'll hopefully start to see, global health being more local, and leaders from the very countries, proximal leaders, partners, and health workers, those closest to the people we serve, writing those stories, right, about how it's being done, not just implementing, but being the authors of that story, of that new chapter of healing that can come from a story of pain and suffering.
Well said.
So I guess I would say more bylines by people who are on the front lines.
Ooh, really well said. That fits well. Bylines by those on the front lines. Thank you, Raj. Degan, what about you? What's your good news prediction?
I'm hoping that by next year we would have launched one infrastructure kind of solution to this issue of connectivity and visibility of Global South actors to each other, but also to the Global North donors and potential partners. And it's called Equity Connect, and it's a platform that we, through the support of Segal and others, that we hope to launch next year. So I hope that we no longer have excuses where USAID or FCDO staff members say, we don't know who to work with in Liberia on the Ebola crisis. That's grassroots organization, a woman-led organization working in health and education. There will be no more excuses to say that you have no visibility any longer of those CEOs in the Global South that you were talking about, Raj. So I hope that this platform will help in some way.
Thanks. We'll be looking out for that opportunity for sure and spread the news ourselves. Well, thank you both. I tweeted out earlier this week, my hope for this conference was to, at Segal, we talk a lot about standing on the shoulders of giants, but my hope was to stand on the shoulders of giants, peeking over the horizon to see what the future of African development might be. Those are your shoulders, you two. This has been a real pleasure. I sincerely thank you for your time. I want to leave our audience with 4 thoughts. Choose hope, fight for self-determination, offer unrestricted funding, get vaccinated. Thanks to everyone. We really appreciate your time. Be well, fight for justice. Thanks, Raj. Thanks.
Thank you.